Well, he's known for his music, but a Toronto area rapper is now trending over his deteriorating health. The 23-year-old MMVA nominated rapper known as John River is opening up on Twitter about a terrifying medical experience and how he felt dismissed by GTA doctors over what he believes is a serious medical condition. In a series of Twitter posts, the rapper, whose real name is Matthew Derek Huey, says he went to the ER multiple times last month for chest pains and was repeatedly sent home by doctors who chalked it up to stress and anxiety. After weeks of his symptoms escalating, one doctor finally agreed to a test involving a needle in his spine, suggesting he could have a cerebrospinal fluid leak, fluid escaping from the brain and spinal cord. But the rapper claims doctors haven't been able to get approval to give him treatment for it because his tests keep coming back clean. The symptoms are so bad now, he writes, he spent days sitting in a closet because of intense sensitivity to light. I've fallen through the cracks of our healthcare system, he tweets. My family and friends have done everything they can, but they can't do any more.
Life is hard. We learn how to deal with pain.
One healthcare consultant who helps patients navigate the system says River's case highlights the common struggles and frustrating situations patients often face, especially in ERs and walk-in clinics, where medical professionals are crunched for time and resources. Do you hear people saying to you, I went to the doctor and they didn't take this symptom seriously, or they brushed me off, or, they didn't really listen to what I had to say?
Absolutely, and that's the problem with effective communication. It's the listening piece that isn't there. It really takes a good history taking to really know what's going on with the patient, and sometimes it can be a number of different things. So the doctor may assume that one thing's going on, but it could be a multitude of different issues. I think it's very important, and I think we all know our bodies the best, and I think that you can have some sense of insistence, not threatening, obviously, or you could ask for a second opinion. Most large ER facilities have several doctors. You can also talk to a patient relations person in the hospital if they're having issues, or the manager of the unit.
Bartley also recommends asking for copies of test results for your own records. And while it may seem counterintuitive, she says, returning to the same ER is sometimes better because they can see the record of escalated symptoms as opposed to starting over. Now, River's family said they weren't ready to speak with the media today, but his assistant tells us that he is at home still dealing with many of those symptoms, and he did put a call out on Twitter asking for the public's help in finding a medical professional who can take his case and help him get the treatment he needs. In Toronto, Janelle Massas, City News.